Hi, Lenore here with MedicarePlanDiscounts.com. Are you turning 65 and about to enroll in Medicare for the first time? If the answer is yes, then this message is for you. Stay tuned. In day 5 of our mini-series, Medicare, the Inside Scoop, I'm going to share with you why now could be the best time to enroll in Medicare. Today I'm going to share with you why now could be the best time to enroll in Medicare. Remember to visit us at MedicarePlanDiscounts.com and to subscribe to our YouTube channel in the lower right corner. Also feel free to like, comment, or share if you receive value from this video. So let's get started.
Why now could be the right time to enroll in Medicare. Knowing when to enroll in Medicare is critical, and enrolling at the right time could save you hundreds of dollars each year. So when is the right time to enroll in Medicare? Great question. Generally, most people enroll in Medicare Part A and Part B when they first turn 65. Your effective date is the first day of the month you turn 65. This is known as your initial enrollment period. Medicare allows you to apply for A and B 3 months before, the month of, and 3 months after your 65th birthday. So what if I'm covered under a group health plan? Another great question. If you have coverage through an employer group plan, chances are you can delay enrollment to Medicare Part B. Under the guidelines of Medicare, you must have credible coverage to delay enrollment to Medicare Part B without incurring a penalty. Now, late enrollment to Medicare Part B can cost you up to 10% of each full 12-month period that you could have had Part B but didn't sign up for it. And that penalty stays with you for the rest of your life on Medicare. So it's very important that you enroll at the right time. So how do I enroll in Medicare? It's easy. There are 3 ways you can enroll. The first is by going right down to your Social Security office and making an appointment and meeting face-to-face with a Social Security expert. The second is to call 1-800-633-4227. You'll actually speak to a live person and enroll over the phone. The third way to enroll is actually online at ssa.gov. Now, if you're going to delay enrolling in Medicare Part B, we strongly recommend that you contact the Social Security office, whether it be by phone or in person, to make sure you don't miss your enrollment period. It's better to be safe than sorry and not be hit with the penalty. So enrolling in Part D, your prescription drug plan, is also critical. A lot of times people think, well, I'm not taking medication right now, so I'll delay enrolling in Part D. Well, the same guidelines that apply for B really apply for D. You actually have to enroll in prescription drug coverage, or Part D, when you first become eligible. Now, if you don't enroll when you become eligible, you will be subject to the same penalties on top of what you're paying for Part B if you've incurred that penalty as well. For more information, please just check out our Part D prescription drug plan video. So Medicare also has what's known as an annual enrollment period. If you're enrolled in a Medicare Advantage plan or Medicare Part C, you can change your plan annually during Medicare's annual enrollment period, which is October 15th through December 7th of every year, and the effective date of your change would be January 1 of the following year. You can also change your prescription drug plan during the open enrollment period. It's really a good idea to do this every year, or just check and see if the plans have changed, so that you're not stuck in a plan with the wrong pharmacies, the wrong coverage levels, doctors not in coverage, and so forth. So during the annual open enrollment period, you want to take a look at the different plans that are available to you. So Medicare also has what's known as a special enrollment period. If you're coming off an employer's group health plan or you're losing some type of credible health coverage, this is known as a qualifying event and allows you to sign up for B and D, Medicare Parts B and D without penalty. Now, you shouldn't have to pay a late enrollment penalty if you enroll in Medicare during the special enrollment period. Medigap. Now, Medigap also has an enrollment period, and that is different from Medicare, Medicare Advantage, and your prescription drug plans. Medigap plans, you can enroll in them at any time, but you may have to answer some medical questions if you don't enroll during the Medigap open enrollment period, which is 6 months before and 6 months after your 65th birthday, or when you're coming off of a qualified group plan. During your Medigap open enrollment period, insurance companies cannot deny you coverage for any plan they offered based on your health. So you want to make sure you're enrolling at the right time. If you don't enroll during the Medigap open enrollment period, you may be subject to the medical underwriting and you may pay a higher premium based on your health. So now might actually be the right time to enroll in Medicare. In addition, from your local Social Security office, we really recommend working with a licensed insured professional to ensure that you get the enrollment periods right. You know, a licensed insured professional won't cost you extra money and they'll actually help guide you through the process. So what's next? Stay tuned for our next video, 3 simple steps to getting started in Medicare. Have questions about yourself personally? Give us a call at 844-280-0785, or you can email us or visit our website at medicareplandiscounts.com.
We've covered some great information today that will allow you to take one more step forward in understanding Medicare. I look forward to seeing you tomorrow on video number 6 in our series, Medicare, the Inside Scoop, where you'll learn 3 simple steps to getting started with Medicare. Remember to subscribe to our YouTube channel and to visit us at medicareplandiscounts.com. Also, feel free to like, comment, and share this video with family and friends that could receive value.